Hi, I'm Dr. Blake Morgan, and today we're discussing a topic that's incredibly important for every man over 60, prostate health. As men age, many experience changes in their health, and one of the most common and critical areas affected is the prostate. The prostate is a small but essential gland that plays a significant role in your reproductive and urinary systems. Unfortunately, many men ignore their prostate health or dismiss symptoms, thinking they're just part of aging. Prostate issues, however, can have a major impact on your quality of life, and if left unchecked, they can even lead to life-threatening conditions. That's why today we're going to talk about the 5 most common mistakes men make with their prostate health after 60, and how these mistakes could cost them their health, comfort, and potentially even their lives. By the end of this video, you'll have a much clearer understanding of how to avoid these mistakes and what you can do to maintain your prostate health for years to come. Whether you're already experiencing symptoms or you're in your 60s and looking for preventative advice, this video will provide you with the knowledge and tips you need to stay on top of your prostate health. Mistake 1. Ignoring early symptoms. The first and most common mistake men make when it comes to their prostate health is ignoring early symptoms. As a urologist, I've seen countless patients who wait too long to address problems, hoping that the symptoms will go away on their own. But unfortunately, this is a dangerous approach, especially when it comes to prostate health. The early symptoms of prostate problems often include frequent urination, especially at night, when you find yourself waking up multiple times to use the bathroom. Difficulty starting or stopping urination. This is a sign that your prostate may be enlarged, as it can put pressure on your urethra. Weak urine stream. A stream that starts and stops unexpectedly can be frustrating and is a sign that your prostate is not functioning as it should. Painful urination or discomfort in the pelvic area. This can be caused by an inflamed prostate, which may lead to prostatitis or other conditions. Blood in the urine or semen. This is a red flag that should never be ignored and needs immediate medical attention. Take the case of Mr. Davis, a 65-year-old patient who came into my office last year. He had been experiencing frequent trips to the bathroom at night for several months. His wife noticed that he was getting up at least 3 to 4 times per night to relieve himself. Despite these symptoms, Mr. Davis dismissed it as a normal part of aging. He didn't want to bother his doctor or worry his wife, so he ignored it. By the time he finally came in for a checkup, his prostate had significantly enlarged, and the damage to his bladder was severe. The longer Mr. Davis waited, the more damage was done, and he had to undergo a procedure to relieve the pressure on his bladder. He was lucky that the issue wasn't more serious, but it's a perfect example of how ignoring symptoms can cause long-term problems. Why do so many men ignore early symptoms? There are a few key reasons. Denial or fear. Many men associate prostate problems with cancer, and the thought of having cancer can be terrifying. So they ignore the symptoms in the hope that it will go away or improve on its own. Cultural beliefs. In many cultures, men are taught to be tough and not show weakness, including when it comes to health issues. Seeking medical attention may seem like admitting vulnerability, not wanting to make a big deal out of it. Men often dismiss symptoms thinking that they're just a part of aging or they don't want to inconvenience their doctor. This mindset can be a dangerous one, as even minor symptoms can indicate a serious problem that, if left untreated, can worsen. When it comes to prostate issues, early detection is crucial. The earlier you identify symptoms, the sooner you can address the underlying cause. In the case of prostate cancer, early-stage detection significantly increases your chances of successful treatment and a full recovery. But it's not just cancer we're concerned about. Enlarged prostate, benign prostatic hyperplasia, or BPH, can cause issues like urinary retention, kidney damage, and bladder problems if left untreated. Let's say you catch the symptoms early and get checked. If it's BPH, you might be given medication or advice on how to change your lifestyle. And in many cases, symptoms can be managed without the need for invasive procedures. If it's something more serious, like prostate cancer, catching it early gives you more treatment options and a better chance for a positive outcome. If you're experiencing any of the symptoms I've mentioned, don't wait. Here's what you should do. Talk to your doctor. Don't put it off. Schedule an appointment with your healthcare provider to discuss your symptoms. If you're over 50 or 40 with a family history of prostate issues, it's time to start having regular prostate exams. Get screened. If your doctor thinks it's necessary, they may recommend a prostate-specific antigen (PSA) blood test or a digital rectal exam (DRE). These are non-invasive exams that can help detect problems early on. Ask questions. Don't be afraid to ask your doctor about what's going on with your prostate health. Understand the results of your tests and what they mean for your future health. Be proactive. Take control of your health by adopting a healthier lifestyle. Maintain a balanced diet, exercise regularly, manage stress, and avoid smoking. These factors can all contribute to better prostate health. Ignoring symptoms can have serious consequences. The sooner you take action, the more options you have for treatment, and the better your chances are of maintaining a healthy prostate. Don't wait until it's too late. Schedule that appointment today and take control of your prostate health. Mistake 2. Lack of proper diet and nutrition. Many men don't realize how crucial diet and nutrition are when it comes to prostate health. A poor diet can lead to inflammation, increased risk of prostate enlargement, and even prostate cancer. The food you eat impacts not only your weight and general well-being, but also the health of your prostate. What you eat matters. Diets high in saturated fats, red meat, and processed foods can contribute to chronic inflammation, which can have a negative impact on your prostate. Studies have shown that a high-fat diet can lead to an increased risk of prostate cancer. On the other hand, diets rich in vegetables, fruits, whole grains, and healthy fats can help protect your prostate. Foods high in antioxidants and anti-inflammatory properties can support the immune system and reduce the risk of chronic diseases like prostate cancer. There are specific nutrients that are known to support prostate health. These include lycopene. Found in tomatoes and other red fruits, lycopene has been shown to help reduce the risk of prostate cancer. It's a powerful antioxidant that protects the prostate from oxidative damage. Zinc. This mineral plays an essential role in prostate health and has been linked to a reduced risk of prostate enlargement and prostate cancer. Zinc is found in foods like pumpkin seeds, oysters, and beans. Omega-3 fatty acids. These healthy fats, found in fatty fish like salmon, walnuts, and flax seeds, help reduce inflammation in the body. Omega-3s are also linked to a reduced risk of prostate cancer and prostate enlargement. Cruciferous vegetables. Broccoli, cauliflower, and Brussels sprouts contain compounds that support the body's detoxification processes and help reduce inflammation. Take Mr. Wilson, a 68-year-old man I treated last year. He had been eating a diet high in processed foods, red meat, and sugary snacks. As a result, he developed severe prostatitis, inflammation of the prostate. When we discussed his eating habits, he realized that his poor diet might have contributed to his prostate condition. We worked together to create a more prostate-friendly eating plan that included more vegetables, whole grains, and healthy fats. Within a few months, his symptoms improved significantly, and his inflammation levels decreased. Prostate-friendly foods to include in your diet: tomatoes, lycopene-rich and excellent for prostate protection. Spinach and kale, full of vitamins and antioxidants that help reduce inflammation. Nuts and seeds, rich in zinc and omega-3 fatty acids. Fatty fish, salmon, sardines, and mackerel are excellent sources of omega-3s. Green tea, rich in polyphenols that protect prostate cells from damage. Prostate-unfriendly foods to avoid: red meat, high in saturated fats, which can increase inflammation. Processed foods often contain preservatives, unhealthy fats, and chemicals that can harm prostate health. Dairy products. Some studies suggest that excessive dairy intake may increase the risk of prostate cancer, particularly in older men. Excessive alcohol can increase inflammation and disrupt hormone levels, potentially affecting prostate health. A poor diet can negatively impact prostate health and contribute to prostate problems such as enlargement and cancer. By eating a diet rich in vegetables, fruits, healthy fats, and antioxidants, you can reduce inflammation and protect your prostate. Remember, your diet is a key player in maintaining your overall health and well-being. Mistake 3. Neglecting regular exercise. We all know that regular exercise is essential for overall health, but many men don't realize how important it is for prostate health specifically. A sedentary lifestyle can contribute to weight gain, hormonal imbalances, and even an increased risk of prostate problems, including prostate cancer. Exercise can benefit prostate health in multiple ways. Maintaining a healthy weight. Obesity is a major risk factor for prostate problems, including prostate cancer. Regular exercise helps maintain a healthy weight, which reduces the strain on the prostate and other organs. Regulating hormone levels. Exercise helps regulate hormones like testosterone and estrogen, which can affect the growth of prostate cells. A balanced hormone profile is crucial for prostate health. Reducing inflammation. Physical activity helps reduce inflammation in the body, which is beneficial for prostate health. Chronic inflammation is a key contributor to many prostate problems. Improving circulation. Exercise improves blood circulation, which is essential for keeping the prostate healthy and functioning properly. Mr. Thompson, a 72-year-old patient, was living a very sedentary lifestyle. He rarely exercised and spent most of his days sitting at home. He developed an enlarged prostate and was struggling with symptoms like frequent urination and difficulty emptying his bladder. After I recommended that he start exercising regularly, he initially felt overwhelmed. However, after starting a daily walking routine, he noticed significant improvements in his symptoms. His weight dropped, he had more energy, and his urinary issues lessened. Mr. Thompson's case is a great reminder that exercise can make a profound difference in prostate health. Walking, a simple and effective form of exercise for men of all ages. Aim for 30 minutes a day to help maintain a healthy weight and improve circulation. Strength training. Building muscle mass through weightlifting can help regulate hormones and improve overall health. Try light weights or resistance bands to start. Aerobic exercise. Running, swimming, or cycling can improve cardiovascular health and circulation, benefiting the prostate. Yoga and stretching. These exercises improve flexibility and reduce stress, which can also help improve prostate health. Regular exercise is crucial for maintaining a healthy prostate. It helps regulate hormones, reduce inflammation, and maintain a healthy weight, all factors that contribute to a healthier prostate. Aim for at least 30 minutes of physical activity most days of the week to protect your prostate and your overall health. Mistake 4. Not taking prostate health seriously after 60 as men age. It's easy to believe that certain health problems are just part of getting older. Unfortunately, many men dismiss prostate problems as inevitable, when in fact they are preventable or manageable with the right approach. Your prostate is a critical part of your reproductive and urinary systems. If it's not functioning properly, it can impact your quality of life. Problems like enlarged prostate, BPH, can cause urinary difficulties, while prostate cancer can be deadly if not detected early. Prostate health should never be ignored, regardless of your age. Mr. Garcia, a 77-year-old patient, came to me with advanced prostate cancer that had spread beyond the prostate gland. He admitted that he hadn't paid attention to symptoms like frequent urination and occasional discomfort, thinking it was just part of aging. Unfortunately, by the time we diagnosed him, the cancer was at a late stage, and his treatment options were limited. Had Mr. Garcia sought help earlier, his prognosis could have been much better. This case highlights the importance of taking prostate health seriously after 60 and seeking regular checkups and screenings. Regular checkups and screenings if you're over 50 or 40 with a family history. It's crucial to have regular prostate exams. These exams can include prostate-specific antigen (PSA) test, a blood test that measures the level of PSA in your blood. High levels can indicate prostate issues, including cancer. Digital rectal exam (DRE). Your doctor will check the size and shape of your prostate to identify any irregularities. Ultrasound or biopsy. If needed, further tests may be done to confirm a diagnosis. Ignoring prostate health after 60 can be dangerous. Regular checkups, screenings, and proactive measures can help detect problems early, improving your chances for successful treatment. Don't wait. Take your prostate health seriously at any age. Mistake 5. Using over-the-counter supplements without consulting a doctor. There are a lot of prostate supplements available on the market, but many of them are unregulated and could do more harm than good. Some supplements may interact with medications or cause side effects, leading to complications in your health. Before taking any supplements, it's crucial to consult your doctor. Many men take over-the-counter supplements without realizing that they could be counterproductive or unsafe. For example, supplements containing high doses of zinc can interfere with your body's ability to absorb other essential minerals like copper. Additionally, herbal supplements like saw palmetto are commonly used to treat BPH, but research has shown mixed results about their effectiveness. Mr. Anderson, a 70-year-old patient, started taking an over-the-counter supplement for prostate health without consulting me. The supplement contained a blend of herbs, including saw palmetto, which he believed would help with his urinary symptoms. However, after several weeks, he experienced adverse effects, including gastrointestinal issues and headaches. Once we reviewed the supplement, we found that it was interfering with his other medications, causing complications. Consult your doctor. Always discuss any supplements you're considering with your healthcare provider. They can recommend the safest and most effective options for your specific situation. Consider proven treatments. Medications like alpha blockers and 5-alpha reductase inhibitors have been shown to help with BPH symptoms and are safer alternatives to unregulated supplements. Focus on a balanced diet. Instead of relying solely on supplements, focus on a balanced diet that includes the necessary nutrients for prostate health. Your doctor may recommend supplements if necessary, but they should never be your first line of defense. Taking over-the-counter supplements without consulting your doctor can be dangerous. Always seek professional advice before using any supplements to ensure they are safe and effective for your specific needs. A balanced diet and medically approved treatments are often the best approach to prostate health. In this video, we've covered the 5 most common mistakes men make with their prostate health after 60. Ignoring early symptoms, poor diet and nutrition, lack of exercise, not taking prostate health seriously after 60, using unregulated supplements without consulting a doctor.